But the majority of the time, what I see in clinical practice, okay, the patients that come to me is a lot of the times what they have on imaging doesn't match up with what we find clinically. All right, we are going to talk about back pain for a second. So one of the things that I see clinically a lot is patients come in, they've got chronic low back pain, and they've had this imaging that shows this finding, and that is the diagnosis they were given. So patient might have midline low back pain, that gets worse with extension, better with flexion, but they've got this MRI report that shows that they've got a bulging disc at L4, L5, or maybe L5, S1. There might be some mild, what's called central stenosis, which is narrowing of the spinal canal, or they might have some mild or even moderate transforaminal or foraminal stenosis, which is where the nerve roots are actually exiting the spinal column. And they walk around saying that the reason that they have back pain is because they have a bulging disc. And in some people that might be the case, because we can have discs that are painful, and that happens quite often. But the majority of the time, what I see in clinical practice, okay, the patients that come to me is a lot of the times what they have on imaging doesn't match up with what we find clinically. And so when we have those situations, the number one thing that I need to do, and that every good doctor should do, is a good thorough physical exam and history that is trying to evaluate what structures might be causing them pain.